Hello and welcome to this program. Today we're going to be discussing heart disease in women. Assessment questions. What is the problem? Who does the problem affect? When the person became affected? Why the person was affected? How this person became affected? What is associated with the problem for the person affected? What actions should be taken for this problem? And what approach should be taken to aid in the solution of this problem? These are some of the questions we're going to be going over in the next few slides. Let us begin. Heart disease in women. Heart disease is the #1 killer of women. Heart disease causes 1 in 3 deaths each year. Heart disease is not curable, but it is preventable. Factors such as blood pressure, cholesterol levels, smoking status, inactive lifestyle, social lifestyle, and more. Lifestyle change could reduce the risk of heart disease in women. Symptoms of heart disease or heart attack on women are lightheadedness, pain, discomfort or numbness in the arms, back, jaws, neck, and between the shoulders, pain, pressure, fullness or squeezing of the chest that could last more than a few minutes, or comes and goes, cold sweats of the skin, trouble breathing, or shortness of breath in the lungs, upset stomach or urge to throw up, possible feelings of tiredness in some days or weeks before a heart attack occurs. Women may have heartburn, a cough, heart flutters, or loss of appetite. To reduce the chances of heart disease or heart attack, one could know your blood pressure, talk to your doctor about you being tested for diabetes. If you are a smoker, you should quit smoking. Schedule an appointment to have your cholesterol and triglycerides checked. Make healthier food choices. Obesity and being overweight increases the risk for heart disease. Reduce your stress level and discover alternative ways to deal with stress. Limit your alcohol intake per day. Women with congenital heart disease are at a lower risk for heart-related complications when they give birth. Average annual CVD deaths on women 35 years and older per 100,000 between 2000 and 2006 in the U.S. is 428. Black women is 566. White women is 419. And Hispanic women is 332. Now let's go over the policy development actions. What has been done in general to address this issue? Resources, facilities, and organizations. You should find this in academic research from the Ashford University Library. There are organizations and foundations that provide educational classes and hold seminars to educate women on the risk and symptoms of heart disease. Within these seminars and classes, the women are equipped with tools and resources that allow them to identify the signs associated with heart disease. Some of the organizations and foundations that are found now are Women's Heart and American Heart Association, Heart.org, Andrews, Graham Garcia, Rains 2001, Malarch, Casper, Kaufman, Brownstein, Croft and Massa 2001, Rodriguez and Foodie 2013, Luer, Maines, Likens, and Reen 2008. Those are the sources used to find this information. What has been done specifically in the community, city, town, state your team is researching to address this issue. Programs and interventions, creations of organizations to address the issue. All over the world, in local communities, cities, towns, and states, people will wear ribbons and participate in walking marathons. This is even observed within the school system. Locally, there are health fairs held to bring awareness to illness that affects all people, but may have a larger effect on those that reside in lower income areas. Once again, listed below are the resources for this information. Now, policy development actions continued. Existing policies. Which policies currently exist to resolve the problem? For example, seatbelts are required by car manufacturers to reduce injury and deaths from car accidents. Currently, the one policy that is in place is the ACA, the Affordable Care Act. With the Affordable Care Act, this makes sure that all people have affordable health coverage insurance that would allow for them to be able to go and get the proper care to treat an illness or to head off in an illness. Heart disease is an illness that has long-lasting effects, like many others, so it is important to upkeep the policy in place. Policy development. What new policies should or could be developed to better address the issue? For example, some communities do not fluoride their water systems. Developing such a policy could help reduce dental caries. With Heart.org, some of the policies that they are trying to get into place and keep in place are: apply a key provision of the Heart for American Women Act that requires the FDA to report on how new prescription drugs and medical devices work in women and minorities. maintain funding for wise women, and CDC prevention programs that provide cardiovascular screening and lifestyle intervention services to low-income, uninsured, and underinsured women. Protect funding for National Institutes of Health research to better understand how heart disease and other forms of CVD affect women differently. Increase the percentage of women who participate in clinical research. Preserve Medicare and Medicaid, both of which disproportionately serve women. Strengthen the percentage of women with access to affordable health insurance coverage through support of the Affordable Care Act, provisions that ban the discriminatory practice of charging women higher insurance premiums than men. Increase access to cardiac rehabilitation. Report healthcare quality measures by gender, race, ethnicity, primary language, and disability status. Support the Health Equality and Accountability Act, which helps eliminate health inequalities among minorities, women, and other groups. Identify stakeholders and potential facilitators. Are there leaders and or organizations within this community that can help be identified and assist with the policy development? Who are they, and what did you specifically select them? For the most part, we are all stakeholders in the fight and implementation on heart disease in women. However, the facilitators would be the American Heart Association and Heart.org. Both of these facilities can be very influential in the policy development process. Make sure to explain how these three essential services that fall into the policy development category are applied to your health problems, inform, educate, and empower, mobilize community partnerships, and develop policies. The three essential services that fall within the policy development are applied to heart disease in women because they conduct research on the issue that is at hand. Once the information is gathered, they relay this to all the people that may have the power and resources to make something happen. Once the information is passed along, the public can be educated on the issue at hand, and then they can empower the communities about the issue and work on the solutions together. And that concludes our presentation for today. These are the references that we've used during this program. I hope you've enjoyed. Thank you.